Hello everyone, I'm Dr. Shruti Tanwar and this is Milo Live Session. Today we'll be discussing UTI in pregnancy. These are the infections of your urinary tract. It is a pretty important topic, I would say, mainly because these infections are very common in pregnancy. As women, we are anyway more prone to develop these kind of infections when compared to males. Firstly, because we have a shorter urethra, and second is the placement. In women, the urethral opening is placed very close and near to the anal opening. And on the top of that, if we get pregnant, the likelihood of having these infection increase even further. There are several causes for that. We'll be discussing them. What happens basically during pregnancy is that all of your organs are making these adjustments and changes so that your baby gets safe and comfortable space to grow. Even your ureter, your bladder, your urethra, they are also making these changes. And that is why your ureters might get compressed because of the growing uterus or the gravid uterus. Even hormonal factors are also into play, like progesterone can cause relaxation of the ureters, which can cause dilation, and there could be stasis, which can cause UTI. Also, there could be backflow of the urine. And lastly, pregnancy in itself is a state of relative immunocompromise. So these are the contributing factors which can predispose you to a UTI in pregnancy. The most significant factor which makes a pregnant woman susceptible to have a clinical UTI is ASB. ASB is asymptomatic bacteriuria. In simple terms, it means that your urine report would show the presence of bacteria even though you are not experiencing any kind of symptoms. This is ASB. But the important thing to remember in pregnancy is that even ASB has to be treated. It is recommended that all of the pregnant women must get themselves tested for ASB, and if found, it must be treated. Because in pregnancy, the chances of complication and severity to the mother and the baby are very high. It could lead to kidney infections in mother, it could lead to preterm labor or abruption in baby. Now we understand the importance of getting this test done. Now we'll move on to the question. The first question we have is, how common is UTI in pregnancy? Well, I would say it is pretty common. As we have discussed the reasons before, I'm not going into that again. About 18 to 20% of pregnant women have to face this infection, these UTIs. Moving on to the next question. What are the common symptoms seen in UTI or bladder infections? Well, if you're having burning sensation in urine or pain while passing urine, or if you're having frequent urination, you're having a constant urge to pass urine, or you can see that your urine is cloudy, or you can see blood in your urine, or there is some kind of pelvic or lower abdominal pain, you could be harboring a UTI. Also, the fever and chills, these are also common symptoms. Flank pain, on the other hand, it may indicate towards a kidney infection. But before you make any kind of self-diagnosis, must visit your doctor. But yes, basically these kind of symptoms are there so that you know when to seek help. Now moving on to the next question. Can UTI cause any harm to the baby in the womb? Well, yes, any kind of infection has the potential to cause harm to your growing sensitive fetus. In case of UTI, they can be, it can make you more prone to have preterm labor, to have PROM, which is premature rupture of the membrane, premature leaking basically, or even placental abruption, which is the bleeding before you deliver. And also, if left untreated or unnoticed, it could lead to pyelonephritis, which is the infection of kidneys. And even a further, more severe complication is sepsis. Sepsis is a very life-threatening complication for the mother as well as the baby. So yes, UTI, be it clinical UTI or be it asymptomatic or ASB, they must be treated and not ignored. Now moving on to the next question. What treatment is given to make UTI, to make sure UTI is safely treated? Well, antibiotics are mostly prescribed because these are bacterial infections, but not all antibiotics are safe. So your doctor, your gynecologist is the best judge to prescribe you a safer antibiotic, which will treat this infection without harming the baby. These are mostly in the form of oral tablets or sachet. But in cases, in complicated or in severe cases, injections have to be given. Apart from these antibiotics, even some other medications can also be given so as to provide some symptomatic relief to you. Now, moving on to the next question we have is untreated UTI risky? Yes, we have already discussed the complications to the mother and the baby. So it's better that you get it treated and just don't keep this infection in your body. Otherwise, it will get even more complicated and severe, which could be detrimental to your health and your baby's health. Also, if ASB, which is asymptomatic bacteriuria, if it is, if it gets untreated, the chances of harboring or having a subsequent UTI is about 25%, which is a lot. So that is why I advise always to get treated. Now, moving on to the next question. Mm, what are the natural ways to treat UTI and can diet help? Okay, now I'm going to give you some sudden tips about how to prevent UTI. Basically, wear cotton underwear and which should not be very tight. It should be of a breathable material like cotton, natural fiber, and make sure that you're wiping from front to back and not from back to front. Also, keep your caffeine and your cool drink intake limited. Cold drinks are anyway not hydrating, they are in fact dehydrating. So avoid them or at least limit them and stay hydrated. Have plenty of fluids, plenty of water, plenty of natural juices. And cranberry juice is a very good and effective home remedy to treat UTIs. Curd could also help. And definitely avoid douching or use of any feminine hygiene products because usually most of them have artificial fragrances and harmful chemicals which can totally disturb your natural flora or natural defenses of your body. Okay, now moving on to the next question. It is our last question. Okay. How do I know I have UTI and what tests to be done? Well, if you experience any kind of symptoms that we have discussed before, it means you have a clinical UTI. And or if your report shows the presence of bacteria in absence of any symptoms, you have ASB. In both of this condition, you have to get treated. Now, the how what test to be done? Yes, the urine sample is tested for routine microscopy with or without a culture. Now, the important thing is that the sample you have to give the sample yourself. So you must know how to give a proper sample which is free from any kind of contamination. So basically, we say a clean catch midstream urine sample should be given. Now, what is a clean catch midstream urine sample? Basically, you just have to wash your hands, then wipe from front to back. Let little bit of urine pass into the toilet, then place the cup under the stream of your urine. Let half of the cup fill and remove the cup. Let rest of the urine pass into the toilet and then close the lid. And you must not touch the inside of cup or the lid, inside of the lid at any time. So that is how you give a clean catch midstream urine sample. Now, um, now we know the importance of this urine test and the importance of getting treated a urine infection. I'm sure this session has cleared most of the common doubts so that you can take care in a better way. Thank you for being part of this session and all the best till we meet again with a new topic.